Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us. Welcome back to the podcast and for spending a few moments with me. If you're plugging in for the first time, I'm glad you're here. Well, this week marks my 6-month anniversary as a Vice President of Emerging Technology Partnerships here at Olive. If you aren't familiar with Olive, we are one of the fastest growing health technology companies in the industry, and our vision is to create the Internet of Healthcare, where the plethora of disjointed back-end systems could speak to one another and create a better experience for patients and providers. During this episode, I wanted to share some updates I've personally experienced during my 6-month journey with Olive and why our team is so excited to work alongside the dreamers, the innovators, and the entrepreneurs who envision a better healthcare system for all. And of course, I'll also share how you and your network can plug into our work and mission. But before I dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn, Twitter, and Clubhouse in order to further the conversations occurring on this podcast. So while I'm celebrating my 6-month anniversary at Olive, I've been fortunate to know and call Sean Lane, our CEO, a friend for several years now. And last summer, he and I met up for a Zoom meeting for him to share his vision for the next big Olive maneuver he wanted me to help launch and build. But before sharing Olive's second big maneuver, it's important to better understand Sean and his deep desire and passion to reimagine the healthcare industry and to hear it directly from him. So on our website at oliveai.com, he writes, quote, "In my previous life, I was an intelligence officer in the Air Force and spent most of my career at the NSA, solving big challenges as a software engineer and technology leader. Looking for what was next, I was drawn in by the prescription drug abuse problem that consumed my hometown in Ohio and impacted my family personally. I wanted to do something meaningful, and that's when I started looking at healthcare. I began looking at the data and was shocked to realize that nothing was connected. Huge enterprise systems completely unable to communicate with each other or share crucial patient information. It was, and still is, a growing multi-billion-dollar problem. Instead, healthcare uses humans as routers, forcing workers to toggle between disparate systems. They copy, they paste, they manipulate data, they become robots. And it's one of the leading reasons that 1 out of every $3 spent in the industry today is spent on administrative costs. With our sights on solving these problems, my team and I iterated almost over a decade looking for the best way to save healthcare. We knew we wanted to change how hospitals fundamentally operated, and we saw a dire need to create efficiency at an administrative level. Suddenly, a light bulb went on. Instead of building new software to replace the disconnected interfaces, we would build the first healthcare AI workforce to automate the robotic, error-prone workflows themselves, emulating the manual tasks employees were stuck doing, only faster, more accurately, and more intelligently. Today, we call this AI workforce Olive, the only artificial intelligence and process automation solution designed specifically for healthcare, end quote. So as you can tell, Sean and I are very much aligned that we can, in fact, no, we must reimagine the healthcare industry. So during that Zoom meeting, Sean shared with me his vision for Olive Helps, this next big Olive maneuver I mentioned earlier, and his passion to have the innovators, the startups, and the developers build with us to save healthcare. I said yes to one of the most exciting opportunities in this industry that I've ever had the opportunity to work on. And I can't wait to share more with you and how you and your network can plug in with us here at Olive after we get back thanking our community champion sponsor. The need for resilient healthcare professionals who can navigate change and crises is higher than ever before. Traditional education has fallen short of providing the necessary skills for when and how they're needed. Dignity Health Global Education fills the educational gap and reimagines workforce development for clinical and non-clinical professionals across the sector. At the intersection of EdTech and custom corporate training, DHGE offers online programs that foster authentic leadership, data-driven decision-making, and entrepreneurial innovation. Developed with CEOs and CNOs, DHGE programs combine industry expertise and top-tier academic knowledge from industry leaders like Duke CE, ASU's Thunderbird, and Pepperdine Graziosi. To learn how DHGE can guarantee an improved ROI on education for your organization, head over to dhge.org or visit the episode notes and click on their link. All right, we're back, and I'm looking forward to sharing more as to what I've been working on over the past 6 months and how our innovators and our startups and developers can plug in. But first, what is Olive Helps? Well, in short, Olive Helps is aiming to be the best digital assistant healthcare workers have ever interacted with, and to give our healthcare workers superhuman powers as they go about excelling at the jobs that are meant to bring them joy and satisfaction. In detail, Olive Helps is a desktop application that gives healthcare workers the information they need right when they need it using cybernetic loops. In layman's terms, think of Olive Helps as the Apple App Store specifically and uniquely built for the healthcare industry. The apps, or in Olive language, loops, that are built on top of Olive Helps are the loops being developed by startups, developers, and innovators. So the end result of delivering these loops via the Olive Helps desktop application helps give our healthcare workers those superhuman powers by delivering real-time intelligence to minimize human error, to mitigate risk and enhance patient safety, and to power healthcare workers' day-to-day tasks, improving the speed, quality, and impact of their work, and surfacing real-time information to improve the decisions and actions of human workers. So overall, the Olive Helps platform works hand in hand with healthcare workers to supercharge human capacity and impact. But why is this platform so important and game-changing for startups, developers, and innovators? Well, there are many reasons, but two that immediately stuck out to me when first discussing Sean's visions last summer is that Olive Helps eliminates the long sales cycle for startups and innovators, which has been historically detrimental to the existence of amazing technologies and innovations. Also, Olive helps our innovators and startups to quickly leverage our massive health system network. As of this recording, Olive is already in 25% of Americans' hospitals. One example of how Olive Helps can supercharge human capacity and impact: think of a patient registrar registering a patient for a procedure, and Olive Helps asks the registrar if the patient needs a ride to and from their upcoming procedure. If the registrar answers yes, Olive will then help schedule a ride with partners like Ride Health or Lyft, Uber, or others. So what is the best way for you to learn more and plug into this incredibly exciting vision and our newest and second big maneuver here at Olive? Well, head over to olivehelps.com and fill out the inquiry form to schedule a demo and to learn more about our newest platform. Our team will quickly be in touch to set up a time to meet. You can also find the link for the Olive Helps website in the episode notes. So as you can see, it's been a very exciting first 6 months for me here at Olive, and I can't wait to see what the next 6 months brings for us as we continue to work together to reimagine the healthcare industry. So if you or someone in your network might be a great fit to join the Olive Helps revolution, don't be shy in reaching out. Let's go cause some good trouble together. For now, to all of our listeners and community members, thank you for your continued support of our podcast and the guest stories we have the honor of sharing with you. For now, here's to better health for every community across our country. Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.